I want to thank all colleagues here today for the attention they have given to this really, really important matter. I also want to acknowledge all upstairs looking down on us that have been here all day. They have travelled far and wide to be here today to tell their stories. As the Minister said earlier, he had to leave early. He's actually attending a meeting with the Chief Executive of the HSE, Bernard Gloucester, and the HSE Board at, I'm not sure whether 7:30 or 8 o'clock, but that's why he has left. And he has assured me that he will be raising this as a priority. We are making progress with the waiting list for spinal surgery despite a significant increase in demands and referrals compared to previous years. We have seen a 13% reduction in children waiting over 4 months for spinal procedures at the end of 2023 compared to 2022. And we also have seen a 5% reduction in the number of children waiting for spinal procedures, excluding suspensions, at the end of 2023 compared to 2022. But we are not for a moment saying that this is good enough. Funding has been provided to deliver this vital orthopaedic and urology services for children. €19 million was committed to scoliosis and spina bifida as a priority in both the 2022 and the 2023 waiting list action plans to increase activity and reduce waiting times for children. And that's all anybody wants. That's all we want. That's all everybody in this House wants. Not to see children suffering, not to see children in pain, not to see appointments cancelled, as Deputy Harkin said, not to see the situation where you get an email to say that you'll be looked after in 4 weeks' time and then that's cancelled. That's heartbreaking for any parent. I'm a mother myself of 3. It's heartbreaking for any parent who is trying to deal with that. And I welcome the fact that Minister Donnelly has announced tonight that there will be an internal audit team, because our job as ministers in government is to try and secure as much funding as we possibly can, at budget time, so that services can be delivered. And we expect the services to be operationalised by whoever is delivering that service. And, if there's a situation where the full amount that was committed to scoliosis and spina bifida as a priority has not been spent, well, that's certainly not good enough. The funding has supported the recruitment of significant additional healthcare professionals, including nurses, consultant doctors, anaesthesiologists and radiographers, and it has supported the opening of a 58er in Temple Street and an MRI in Crumlin, along with additional beds. And at the time when all of these were opened, we were very, very hopeful. Additionally, this investment has supported more capacity through national outsourcing at CAPA, and this has resulted in an increase in activity. The number of spinal procedures undertaken in both 2022 was 509 procedures, and in 2023, 464 procedures were carried out. This represented a 34% increase and a 22% increase, respectively, compared to the 380 procedures carried out in 2019. However, despite undertaking a record number of spinal procedures over the last 2 years, the expected reductions in the waiting list were offset by a significant increase in demand and referrals compared to previous years. So we've seen a 42% increase in cases presenting compared to 2018. As I stand here tonight, there are currently 288 children on the waiting list for spinal procedures, including suspensions. The latest National Treatment Purchase Fund waiting list figures for January 2024 show that there are 890 patients waiting for an inpatient or a day case orthopaedic procedure at Children's Health Ireland. Since December 2023, there has been a decrease of 4% in the number of children waiting outside the 12-week target. In terms of urology procedures, there are 476 patients waiting for an inpatient or day case urology procedure at Children's Health Ireland. Since December 2023, there has been a decrease of 5% in the number of children waiting outside the 12-week target for inpatient or day case urology treatment. The Minister and I accept that waiting lists for scoliosis and spina bifida services are far too long. The Minister intends to convene a dedicated stakeholder task force and met with patient advocacy groups yesterday to explore the terms of reference for this task force. A dedicated paediatric spinal surgery management unit has been established in Children's Health Ireland. This unit is focusing on the management and the delivery of spinal surgery, including reform of the waiting lists. Work is underway on a paediatric spinal care programme of work. This programme includes actions being taken to address the current waiting lists, such as the implementation of identified improvements to the management of spinal surgery and the waiting lists. There is also ongoing work in relation to outsourcing options for clinically suitable children in order to increase capacity for this vital service. And I know there's work underway in relation to one facility in Northern Ireland. It's been explored in relation to outsourcing clinically suitable children. The programme is also looking to the future, and work has begun to design a dedicated paediatric spinal service for the new Children's Hospital, which this government is committed to seeing open as soon as possible. Scoliosis and spina bifida were identified as a priority, as I said, in 22 and 23 in the waiting list action plans, and the €19 million of current and capital funding committed to tackle these waiting lists by improving the patient's journey and creating additional capacity. The investment has supported an increase in the number of spinal procedures undertaken, as I said, in both 2022 and 23. And scoliosis and spina bifida services will continue to be priority areas under the 2024 waiting list action plan. Despite undertaking a record number of spinal procedures over the last 2 years, the expected reductions in the waiting list was offset by a significant increase in demand and referrals compared to previous years, with a 30% increase in additions to the spinal fusion surgery list in 2022, a 42% increase in 2023. In recognition of the significant increase in demand, the HSE, the NTPF and CHI are exploring all options to increase capacity for this vital service. Finally, I would like to reiterate that the Government acknowledge that waiting lists for scoliosis and spina bifida are too long, and that many patients are waiting an unacceptable long time for care. And there is nothing worse for any parent than to be looking at their child in pain. There is nothing worse for any parent than to get that letter in the postbox to say that their child has got a referral date and then the date is suspended. There is nothing worse for a parent when their child is authorised for surgery and there may not be sufficient nurse and staff to look after the child, especially when it's a very complex care. I will continue to work with Minister Donnelly to do my utmost to make sure that we can make progress on this for all those children that are waiting. I would like to reiterate that this issue is not financial. Minister Donnelly allocated a significant amount of funding to CHI over the last 2-3 years to make sure that children shouldn't have to wait any longer than necessary. But unfortunately, even though the funding was allocated, we see such a demand on services. Waiting lists have grown, and I accept that it's not good enough. We are committed to improving waiting time for children seeking scoliosis and spina bifida care, and all we want to do is benefit the children and their families who need this care.